Hello, this is Dr. Mukhtar Yerima. Welcome back to my channel. Today, I'm going to talk about adult ADHD. Attention Deficit Hyperactivity Disorder, ADHD, can affect not just children and adolescents, but also adults. Usually, a proportion of children and adolescents with ADHD continue to have their symptoms even as adults. However, since ADHD is a neurodevelopmental disorder, the symptoms of ADHD must have been present in childhood and adolescence. Although there are times when the child may have ADHD and the condition may go undetected and therefore undiagnosed, it is nonetheless a necessity for the symptoms to have been there in a child or an adolescent, even if it was not diagnosed. Therefore, when we're talking about adult ADHD, the symptoms must have been there, regardless of whether they were diagnosed when he was a child or adolescent. And in order to identify the presence, or in order to really find out whether he had these symptoms as a child and adolescent, there will be the need to look at his past medical records and also records from teachers and other people who have known him as a child. At least 10% of children and adolescents with ADHD would continue to have symptoms that meet the criteria for the diagnosis of ADHD even as adults. It can be as high as 50 to 60%, which means of all children who have had ADHD, more than 1 in 10 of them would continue to have their symptoms even as adults. This is going to come with all the associated disabilities and impairments occasioned by the illness. Now, what are the differences between the manifestations of ADHD in an adult versus what you find in a child? Well, the different categories of symptoms of ADHD in children are going to be found in an adult. However, since the person is now an adult, there is some form of both physical and mental maturity. Some of the symptoms tend to be modified. They do not present in exactly the same way that you find them in a child or an adolescent. Also, for the diagnosis of ADHD to be made, the person must have had the symptoms of ADHD before the age of 12. So if an individual comes, he has all the symptoms of ADHD or some or most of the symptoms of ADHD, and there is no evidence to suggest that he has had these symptoms before the age of 12, then it is likely not going to be ADHD. There may be another condition that can explain these symptoms that he is now having. So how are the symptoms of ADHD different in an adult than in a child? Usually, the same categories of symptoms are usually found in an adult. The symptoms of inattention, the symptoms of hyperactivity and impulsivity. These are similar and they are found also in adults. However, usually there tend to be a modification in the presentations of these symptoms in an adult. Remember, he is now much matured. His intellectual capacity has much improved and he is generally physically more matured also. So the manifestation of the symptoms in an adult is going to be slightly modified, especially in the category of the hyperactivity. In hyperactivity, remember, a child with ADHD will be jumping excessively, climbing excessively, running excessively. Of course, as an adult, you may definitely not find that. Hardly would you find an adult jumping, climbing. However, what adults may have is that they may have these inner feelings of restlessness, and they might also sustain that feature in which there is fidgeting and squirming, so that although they may not be able to be jumping, running, climbing, you might still find that kind of squirmishness, that kind of fidgeting, and all those things that were present in a child. Additionally, in an adult, you may not find them kind of being always on the go as if they're motorized. They may have an inner drive to want to always be on the go, but you will not see it being outwardly manifest. You may not find that they will now be this kind of a child who behaves as if he is motorized, always moving, always doing something. Also, in an adult, you might find that one of the features of hyperactivity, which includes talkativeness, might still be there, but that it is probably going to be a little bit more controlled. But they are nonetheless going to continue to exhibit those features of hyperactivity, including the talkativeness, albeit in a modified form. The inattentive symptoms of ADHD in adults tend to be the ones that are more pronounced. For instance, the individual will continue to have low attention span. He will continue to be forgetful. He will continue to show low attention to details. He will continue to have kind of difficulty following through on instructions. Therefore, he will continue to make silly mistakes that are not expected for his level of knowledge and for his level of expertise. And they will continue to have difficulty or insistence not to indulge in activities that require persistent mental effort. So the inattentive symptoms of ADHD are the ones that are more likely going to be pronounced in an adult. And these inattentive symptoms, as we remember, include low attention span, difficulty paying attention to details, forgetfulness, losing things that are needed for work, inability to sustain attention, especially on tasks that require persistent mental effort, having difficulty listening when he is being talked to directly. So these are some of the inattentive symptoms, and they tend to be more pronounced in an adult, unlike a child that is more likely for you to see the hyperactivity symptoms. Also in adults, the impulsivity or the impulsive symptoms of ADHD are also a little bit more pronounced. Impulsivity is, as we mentioned in our previous video, the inability of the person to think through a course of action, and therefore they will go ahead and do something without thinking it through, regardless of whether the action is going to be associated with risks and whether it is going to be associated with a lot of consequences. They do not care. They are going to go about it. So in essence, because of the impulsivity, you see them going about some actions that are even potentially dangerous. So for instance, you therefore see them engaging in risky behaviors, including dangerous driving and making them at risk of having road traffic accidents. Also, because of the impulsivity, they would have difficulty with social relationships because you are supposed to wait for people to finish talking, usually when in a conversation. And if you have difficulty waiting for your turns because of the impulsivity, you will just keep talking at inappropriate times and at inappropriate places, and that would turn off people, and that would make people to have difficulty getting along with you. Also, because of the impulsivity, the individual tend to blurt out answers even before questions are fully asked. This again tend to put off some people, especially bosses at places of work, and that will contribute to his difficulties with work. In addition to this, remember, he already has difficulties with work because of the inattention. He might not sustain one course of action. He will start a task. Before finishing it, he will start another one. And also, he does not want to continue to do a task that require a lot of persistent mental effort. So because of that, work and other job responsibilities become a lot of difficulty, and this person would have a lot of job issues. So by and large, in an adult with ADHD, first of all, the symptoms have to have been present as a child. And if the person does not have symptoms of ADHD before the age of 12, ADHD cannot be said to explain the symptoms that he has, even if the symptoms look like those of ADHD. Number two, the symptoms of ADHD in adults tend to be slightly different from what we find in a child. In an adult, the symptoms of inattention and impulsivity tend to be more pronounced, and because of that, they tend to have a lot of difficulties with work, a lot of difficulties with relationships, and a lot of difficulties even with friends. Also, they are more likely to engage in reckless behaviors, including reckless driving, which will make them vulnerable to having motor or road traffic accidents. Overall, these are some of the few things I thought I should highlight concerning adult ADHD. However, it is a condition that can be controlled with medications and with some forms of psychological intervention. So if you think you have features to do with ADHD as an adult, or if you know an adult in your life who you think has any of those features, please suggest to them to see a mental health professional who would try to establish whether these symptoms are really symptoms of ADHD, or in fact, they might be explained by another medical or another psychological condition. That's it for now. Thank you for listening.